Happy Sunday, everyone. So as we on this fast, no, I'm not going to talk about food, but I think this is quite fitting. I'm going to be talking about glaucoma. So the importance of our spiritual eyes as I speak about the natural part of your vision. So I'm going to let me share my screen. So this is just a little picture of what your eye is supposed to look like, actually, about the drainage canal, what a healthy eye looks like. The healthy eye, you have the front chamber of the eye, you have the iris and the cornea and the optic nerve. Then you have glaucoma. So you can see the difference in what the eyes look like when someone has glaucoma. So what is glaucoma? And I'm going to go through that quickly and what causes it. So glaucoma is a general term used to describe a group of eye disorders that damage your optic nerve. It is the most common form of optic nerve damage, leading to vision loss. In most cases, fluid builds up in the front part of your eye. This extra fluid puts pressure on your eye, gradually damaging your optic nerve. Glaucoma can occur without any cause, but many factors can affect it. The most important of these factors is intraocular eye pressure. Your eyes produce a fluid called the aqueous humor that nourishes them. This liquid flows through your pupil and to the front of your eye. In a healthy eye, the fluid leads through the drainage canals located between your iris and the cornea. I know it's a lot of medical terms this morning. With glaucoma, the resistance increases in your drainage canals. The fluid has nowhere to go, so it builds up in your eye. This excess fluid puts pressure on your eye. Eventually, this elevated eye pressure can damage your optic nerve and lead to glaucoma. So what are some of the risk factors? Glaucoma can damage vision before you notice any symptoms, really. So be aware of these risk factors. High internal eye pressure, also known as intraocular pressure, which I just spoke of. Age over 40, Black, Asians, or Hispanic heritage, if you have a family history, certain medical conditions such as diabetes, migraines, high blood pressure, sickle cell anemia, corneas that are thin in center, extreme nearsightedness or farsightedness, eye injury or certain types of eye surgery, taking corticosteroid medicine, especially eye drops, for long periods of time. Some people have narrow drainage angles, putting them at increased risk also for what's called angle closure glaucoma. So what are some of the symptoms of this? So symptom depends also on the type of glaucoma one has. Symptoms can include eye pain, headaches, which can be severe and require immediate medical attention. Other symptoms, eye pressure, rainbow-colored halos around lights, low vision, blurred vision, narrowed vision or tunnel vision, or blind spots, nausea and vomiting, and red eyes, just to name a few. Please note, one of the problems is that for some types of glaucoma, there aren't any early warning symptoms, and changes to vision can happen gradually, so the symptoms are easy to miss. It is very important, and I want everybody to remember that, it's very important to have routine eye exams to detect this disease in its early stages. So yes, there are different types of glaucoma. So what are some of the types? You have what's called the open angle glaucoma, and this type is the most common, affecting here in America up to 90% of Americans who have glaucoma. This disease may go unnoticed for years because most people have no symptoms. Closed angle glaucoma, also called angle closure or narrow angle glaucoma. This is a rare type, often comes on suddenly, so it's very acute. Then you have the normal tension glaucoma and congenital glaucoma, otherwise called childhood, infantile, or pediatric glaucoma. Some babies are born with drainage canals that don't form properly in the womb. So how is it diagnosed? The only sure way to diagnose glaucoma is with a complete eye exam. A glaucoma screening that only checks eye pressure is not enough to find glaucoma. During a glaucoma exam, your ophthalmologist will do one of these painless tests: dilate your eyes, gonioscopy, optical coherence tomography, ocular pressure tests, just to name a few, visual acuity tests, and visual field tests. Those are some of the tests that doctors may actually do. So what are the treatments? Treating glaucoma successfully is a team effort between you and the doctor. You'll see who's called an ophthalmologist who will prescribe medication, glaucoma treatment. And the treatment can be medications, and it could be surgeries, whether it's laser surgery or other types of surgery, depending on what the specific and severity of the the severity of your glaucoma is. So the ophthalmologist will determine that. They'll also give you things that you'll have to take at home. So please make sure you follow those directions and don't stop it quickly. That's important. You must stay the course. So how can one prevent glaucoma? Early detection of glaucoma through a routine eye exam is the best way to protect eye health and prevent vision loss. Glaucoma testing should occur every 1 to 3 years after age 35 for people at high risk, 2 to 4 years before age 40, 1 to 3 years between ages 40 and 50, 1 to 2 years between ages 55 to 64, and 6 months to 12 months after age 65. You should call your healthcare provider if you're experiencing any blurred vision, low vision, the halos that I am spoke about, eye floaters or flashers, sudden severe eye pain or headaches, sensitivity to light, vision loss. With proper care, you can keep glaucoma from worsening and causing irreversible vision loss or blindness. So of note, untreated glaucoma or poorly managed glaucoma can lead to permanent or irreversible vision loss and blindness. Most people develop glaucoma in both eyes. Although the disease initially may be worse in one eye, with open-angle glaucoma, one eye may have moderate or severe damage, while the other eye may be mildly affected. People with close-angle glaucoma in one eye have a 40 to 80% chance of developing the same type of glaucoma in the other eye within about 5 to 10 years. Glaucoma is a common age-related eye issue that affects an estimated, here in America, only about 3 million Americans. Globally, it is the second leading cause of blindness after cataracts. So what are some questions people may ask? Well, what are the complications of glaucoma? An estimated 1 in 10 people with glaucoma develop some degree of visual impairment. Blindness is less common and affects 5% of people with glaucoma. Can glaucoma be cured? No. There's no cure for glaucoma. However, you can manage symptoms and stop the disease from getting worse. What is the most effective treatment for glaucoma? There isn't one best treatment for glaucoma. Your provider may suggest one treatment for you and a different one for someone else who has glaucoma. I want to give special acknowledgement to the American Academy of Ophthalmology, National Eye Institute, the Mayo Clinic, and the Cleveland Clinic for the information that I provided you today. I hope this was helpful. Should you have any questions, please join us in the Zoom immediately after service. I'll be happy to answer those questions for you, whether it's related to glaucoma or even continuing on the fast. God bless and enjoy the rest of the service.